Okay, thank you, Supervisor Fletcher, for joining us, Chair Fletcher, newly. Appreciate taking the time so early in your tenure and look forward to hearing what you have to say about the coming year and a chance to ask you some questions. So why don't you take it away?
Yeah, thank you, Matt, and thank you all for having me. If you go back 2 years ago, when I came before the Ed Board and was running for Board of Supervisors, I said I believed the county needed to fundamentally change. I believed it needed to go in a more progressive direction, and I also believed it needed to go in a more aggressive direction, being less passive, being more engaged. And the county has tremendous obligations and responsibilities that are countywide. Obviously, there's the functioning in the unincorporated, where we do things that cities normally do. But I think that I think the county's probably done those well over time. But where we needed to see significant change was a county that was going to step up and lean in a bold way to addressing the regional problems we face, particularly around issues of public health, of mental health, of substance abuse, of behavioral health, of correction and prison reform, of lowering recidivism, child welfare, environmental issues. The county plays a significant role in. And I think in the 2 years I've been here, I got done more than I thought I would get done. Coming into an entity that was a 5-0 block and being the first one to kind of break that mold. We have nearly 70 different individual policies that we were successful in passing. Some of them more significant than others, but the largest increases we've seen in mental health and behavioral health, the beginnings of change around how we're treating folks in our jails. We still have some work to do there, and that's not entirely within our control. But a variety of things where I think that we made progress. I think we responded to a lot of issues of racial injustice in a positive step, certainly more to do, environmental issues and other things. But we haven't done enough, and we haven't gone far enough, and we haven't institutionalized a fundamental change in culture in county government that says we are here to do the greatest good for the greatest number in a financially responsible way, but to really view our role as being a leader and driver, particularly of issues around health and human services and public health. And so now the voters have spoken, and the prior board governed very conservatively, and that's who they were, and that's who the voters elected, and that's entirely appropriate. Well, now the voters have elected new folks, and I think this gives us an opportunity to take the progress of the last 2 years and really accelerate it and really ramp up and get our county to where I believe that it needs to be, which is a county that is forward-looking, the county that is tackling the hard and difficult issues. I said in my chair's address, easy things have been done. We're going to do hard things. Things like behavioral health are hard. COVID, it's hard. Child welfare, prison reform, these are hard, difficult issues, but we're going to do them honestly and upfront. And I am excited about the new board that's coming in because there is a new energy and there is a new drive. But we also have a board that brings tremendous experience. Nora Vargas brings not only life experience, but she brings tremendous public health experience. She has legislative experience at the state. She's hitting the ground running. I was on an hour-and-a-half COVID call with her this morning, and she's going to contribute significantly. Tara Lawson-Remer brings a tremendous experience to the Board of Supervisors, an economist, an environmentalist, a lawyer, national experience and perspective. She's going to add significantly. Joel Anderson is someone who, I alluded to it yesterday. I watched him have the unique ability to hold true to his values and convictions, but be willing to work collaboratively to do things. Joel found time and again ways that he could partner with Democrats in Sacramento to advance causes and issues. And so I think we've got a mix of folks that are ready to figure out how do we move forward and how do we go in a more progressive direction, but also in a more aggressive direction, with the county stepping up and being willing to lead and invest and do things. And so a part of that at State of the County in February, I'll outline a lot of the specific policy ideas and focuses that I think we need to do as a county. And that'll have a lot of a huge focus around behavioral health. That's been my highest priority as a candidate. Obviously, COVID has dominated everything, and we're going to continue to have that be our focus. But we don't want to lose the momentum that we were gaining around issues of mental health and substance abuse, and fundamentally rebuilding that entire system. That'll be a focus, and we'll have a lot of other policy areas that we want to do. But what we're going to consider on Tuesday, kind of what we call our framework for the future, is a reorientation of the way the county operates in general. It's not necessarily 27 individual policy things, but it is some of that structural reform and change that needs to happen. And I'll quickly walk you through very quickly the items that we're bringing forward and the rationale for them, and then can answer any more in-depth questions about anything we're doing. The first one I'm doing with Supervisor Vargas is just a COVID-19 resolution and policy. And you know, our county response to COVID, I think has been significantly better than Hep A. Now that's a pretty low bar in terms of what we're doing. But from the Board of Supervisors level, it has at times been erratic and inconsistent. I was notably on the losing end of multiple 4-1 votes of the board wanting to protest the governor or defy the governor or don't do this or don't do that. And I think the situation we're in now has validated the unfortunate hard truth that you cannot avoid making the difficult decisions. You simply can't avoid them. The cost and loss of life and the cost and negative impact of the economy from an out of control pandemic is greater than the cost associated with the measures we do to reduce it. And that in no way detracts from the very real impact that what we're doing is having on restaurants and small businesses, or the tremendous empathy or pain we feel for them, but we can't avoid dealing with that. And so one of the first items we're going to consider is have the Board of Supervisors speak, at least the majority of them, to say, we believe COVID is real. We're not buying into the conspiracy theories and disinformation and nonsense that's out there. We are going to essentially retract or override the 7 or 8 letters that we sent telling the governor that what he's doing is wrong. And we're going to align with the state. We're going to align with public health and science, and we are going to difficultly get ourselves through this process. And I think that is important because the public has seen a lot of mixed messaging around this. And I don't think that'll be a majority vote, but I think the majority of the board will speak with one voice to say we cannot avoid confronting the realities we face. A second part to that one, and this is one that I think is really important, is to make sure that we're prioritizing funding. I have fought tooth and nail and moved heaven and earth to try to make sure that we're responding to COVID in a proportional way, meaning when you have a Latino community that is 30% of the population and 60% of the cases, you can't have an equitable distribution of testing or other resources because COVID is not being equitably distributed throughout our community. It's disproportionately impacting low-wage service workers who have to go to work. It's disproportionately impacting people who live in higher densities of households. And I fought, if you remember when we did the CARES Act distribution to cities, I just said, hey, we shouldn't give every city just divided up by population. It ought to be, the money ought to go to cities based on how many cases they have because they're having a greater impact. We had no ability to have success in doing that. And I think that the response that we do needs to be aware and conscious of the disproportionate nature and impact of COVID. The same was true when we did our business stimulus grants, and my office led the way for every one of those economic assistance programs for small businesses. And I wish we could have done more for businesses who, through no fault of their own, had to close or limit their operations. But again, it was just divvied up by supervisorial district, and every district got the same amount. Well, you saw certain districts that had, orders of magnitude greater need than others. And so I think we want to be mindful that we have data guide our way as we move through this. So that's the first one we're gonna take up, is going to be around COVID. Nora Vargas, who obviously represents the communities most impacted, vice chair of the board, and she's now on the COVID subcommittee with me. We're bringing that one forward. The second one I'm also doing with Supervisor Vargas is a resolution just declaring that racism is a public health crisis. And I think this is an acknowledgement of the obvious. When a child in Barrio Logan is 8 times more likely to have asthma than a child in La Jolla, I don't think that's just random happenstance. A series of historic government policies over time have created a lot of the inequities that we face in our society today, and it's going to take intentional government policies to help address those and move forward. And so a number of other jurisdictions have done something similar, and there's a symbolic aspect to declaring it and saying that we're doing, but there's also some substantive parts in there. There are processes in there as a county that will create a process for community input to ensure that county policies and practices are engaging and listening to the community. We're going to revise the statement of values, mission, vision, strategic plan to make sure we are guiding towards issues of equity and racial justice. We're going to add a section for every board letter, an equity impact statement. There's a lot of things when you draft a policy for the Board of Supervisors that you have to figure out what is the fiscal impact, what is this impact, what is that impact. We want to be intentional. with every policy bringing forward an equity impact statement. What are the impacts on issues of equity? And we are going to enhance data collection to identify racial disparities amongst programs and services designed to improve health, social, economic, criminal justice, all these types of things. And an example of this would be in a recent Live Well presentation, we touted that, I forget one of the major ones, heart disease had declined, a few percentage points, and that was a success. But I said, well, wait a minute. We need to break that out, because if heart disease amongst people who are already healthy declined 10%, but it went up 7% in a community that has historic underlying health conditions, is that really a success, or is that not a success? And if we're going to address issues of equity, then we have to be driven by data, and we have to hold ourselves accountable to this. And so there is some substance behind what would appear to be a generally symbolic effort. We also, last year, my office we created the Office of Equity and Racial Justice at the county. That is just getting staffed up. We want to empower that to be more robust, enterprise-wide and system-wide. We also brought back the Human Relations Commission, a group of citizens, who gathered to do these issues. And again, we want to fold those in to everything we're doing. The third thing that we're doing is a legislative plan overhaul. I think there's a couple, again, fundamental cultural shifts that need to happen in the county. One relates to our relationship with the city of San Diego. The city and the county have historically always been at odds, and that wasn't ideological because they were all Republicans. They still didn't like each other. We got to get over that. We are bound by geography, and we're bound by mission. We have the same mission to serve the public. And so much of what we do at the county overlaps in jurisdictions, not just with the city of San Diego, but with the 18 incorporated cities. And so we have to align what we are doing and say, look, there will be some rubs here and there. But, to use a NASCAR analogy, when you're rubbing, you're moving in the same direction, not this crashing into each other. And so Mayor Gloria and I have a great relationship, and we've committed, we're going to bring our two entities together, and we're going to work through difficult issues and challenges, but we're going to understand that, especially when it comes to issues of homelessness, mental health, substance abuse, even housing, there are tremendous opportunities that can be reached if you have a city and a county that are willing to work together to let the last 20 years of bickering and so-and-so doesn't like so-and-so from something that happened when I wasn't even here. We got to let that go. The second part of that is our relationship with the state of California. The county is technically a subdivision of the state. I view the state government as a resource to San Diego County. And when I ran, people said he's a Sacramento insider and this and that. And I said, yeah, I am. And that will be to the benefit of the people of San Diego County. We have not had a board of supervisors or a supervisor who had the depth of relationships. And we've drawn down tens of millions of dollars in funding and priorities and protocols that have helped San Diego because we have a collaborative relationship. We also have a unique opportunity when you think about, you have a governor who knows where San Diego is. He's been here multiple times. He sat right here in this office, right? I talk to him frequently, and others do as well. But from a legislative standpoint, we have the chair of the Appropriations Committee is from San Diego. I happen to know her. I'm very fond of her. It's my wife. We also have the president of the Senate from San Diego. We are in a prime position to partner and advocate and work with the state. But we have this legislative program that you talk about the 1970s, once they're like record player back. I mean, it was like 117 pages of old stuff in there. Some recent, we're going to oppose Dr. Weber's use of force bill. No, we're not. We're going to accept it, and we're going to move forward trying to tackle it. But you had things in there about making it harder for people to vote. You had things in there that as a county, we would advocate to deny anyone who had been convicted of a crime from accessing government services. My God, when they get out, do we not want them to get rehabilitated and restored? And it literally was just a treasure trove of the last 40 years' greatest conservative hits. We're wiping it out completely. We're going to take the ledge plan, 117 pages of it. We're going to zero it out in its entirety. And we are going to start fresh with a new statement of values that the County of San Diego will actively engage in advocacy in the following areas: local, state, federal, international, to ensure we serve our constituents. And then we're going to have priorities, right? We want our Office of Intergovernmental Affairs to go out and look for ways we can serve San Diegans with COVID response, behavioral health, homelessness, affordable housing, environmental justice, and a variety of things. And then we're going to have overarching principles. We are going to work collaboratively with the state, with our 18 incorporated cities, on binational affairs with our partners south, promote fiscal integrity, equity, government transparency. And we'll have to fill that in as we move along. But so often there's this, well, we've got this old county policy. And so as it relates to our relationships with other governments, which are a critical and central part of what we do, we're going to clearly send a signal that we're going in a new direction. The next one I'm doing with Supervisor Lawson Reamer is a relook at policies that govern our fiscal approach. And I think it is important to state no one, certainly not me as chair, is going to allow our county to get in the financial situation that they were in 30 or 40 years ago. When I went to the state of California, the day I was sworn in as a legislator, we had a $42 billion deficit on a $100 billion total. The governor recently pointed out that is the worst deficit California's ever had. I lived through that every day of my legislative experience. We will not return to a situation like that. But saying you're not going to go bankrupt is a core principle and something we're not going to do. But that doesn't mean that you can't be fiscally responsible while making the appropriate investment. And that's where we need to go through and look at each and every one of the policies that we have in place. I've been told by financial experts, some within the county, that the notion that you have, we talk about, we have 2 months of operating reserves. It's important to note that that is everything out there, including money that is not ours. So every pass-through dollar we get from another entity, we hold 2 months of that in reserves. There is no scenario by which the federal government ceases to exist, the state government ceases to exist, but yet the county is expected to make out those payments. And so we need to reevaluate what is the proper amount of reserve consistent with accounting standards and best practices that we ought to have. And then where are those opportunities for investment? There are other policies we have in place about not taking, if there's a pilot program and it only exists, it's only funding for a set number of years. Well, by county policy, we won't do that, because we won't start a program if it's not an ongoing revenue stream. Well, if we have a pilot program that's going to make people's lives better for 5 years, let's go get the money and make people's lives better for 5 years. And maybe we learn something along the way. And maybe we can justify continuing it, or maybe the program continues. But Tara Lawson-Reamer and I will form a subcommittee of the board, and we're going to plow through all of these policies and figure out, hey, that one's good. Okay, that one, no, we probably don't need that one anymore. We have an arbitrary cap on the number of employees we can have in Health and Human Services as a percentage of the population. That doesn't exist for any other branch of county government, only Health and Human Services. Well, why is that? Because when we want to rebuild our jail correctional health system, and I believe it would be done better if we do it ourselves, well, we don't have the ability to do that because we have this arbitrary cap that doesn't exist. And so we want to challenge each and every one of those. We also want to increase the focuses on performance management and looking at, one of the challenges I've had in, arguing about greater investment in healthcare in our jail system is we pay for that either way. It's morally right to provide the care to those folks, but it also, we're going to pay for it either way. If they come out and they cycle in and out of our psych hospital and in and out of poverty and in and out of the ERs and go back, there is a cost associated with that. And so looking at how we do that. And then the last piece of that is really looking at our procurement process. We want it to be transparent. We want it to be accessible. We want to ensure that everyone has the opportunity to participate in that. So that's that one. The next one I'm doing, 2 more and then we're done. As a government transparency one with Supervisor Anderson, we're doing this together. This really is about opening up county government. 2.5 years ago, I had the first community town hall, budget town hall. All the county folks sharing data, answering questions. Here's what we do, here's why, getting feedback and input. I've led the effort to have evening budget hearings, bring those back, evening Truth Act hearings. I think our government is better when it is accessible and people can do it. And so Supervisor Anderson and I are launching a process to really look at what we can do as a county in terms of being more transparent. Our Public Records Act request, we need a portal. Other places have a portal. You can see everyone that's already been requested. You can see what the response was. You can see when it gets submitted, when it comes out. We have archived public records. I don't know if anyone's really interested in Board of Supervisors meetings from 1890. But if you are, we have those records. They ought to be accessible to you and you ought to be able to see them. I don't think our email retention policy makes sense. I don't think 60 days, you automatically delete everything at that point makes any sense. It's not like we don't have, it's not like there's space on the shelf where we can't store the things for a longer period of time. And then we also want to, in my mind, transform our budget process. It is not as transparent. I came from the legislature. We have multiple budget subcommittees. It's very open. People can comment and work through. And so we're going to look at all of those operations of county government, how we can be more transparent, how we can be more accessible, and how the public can have a better sense of what their county government is doing and why, and provide input. And then the last one is one I'm doing with Supervisor Lawson Reamer around climate change and issues of the climate action plan and our approach to these issues. Obviously, the county has drug on for decades and decades. I don't know what Judge Taylor will do with all of his free time with the new Board of Supervisors, because he won't have to write 17 more opinions telling the county they're wrong. He will be able to take up a new hobby. We're going to make clear as a board that we believe climate change is real. We believe we need a legally enforceable climate action plan. It must be measurable. It must be verifiable. It has to be with real data that is accurate data. And we're going to align our land use policies consistent with that. It's time that we get out of this cycle of approving projects that we know are never going to survive legal scrutiny. We're wasting a lot of people's time. We're also fiscalizing land use in the wrong direction. There is housing that can be built in the unincorporated areas consistent with the general plan. We need to devote our energies towards ensuring those housing units get built while we also make sure we're doing what we can to tackle issues of climate change, and then overall issues of water quality, air qualities. We have some significant challenges around stormwater. So as a board, we're gonna make a clear and definitive statement where the majority of the board stands on environmental issues and lay out a path. Those are the issues, again, that are kind of providing the framework that I think will allow us to then come in February and State of the County, and as other supervisors have idea, and fill in the details of what the policies will be to achieve the aims of a more equitable, more fair, and more engaged county government. So I will stop there and would be happy to answer any questions.
Supervisor, it's great to hear you have this reform spirit, but I look at the state of California and the idea that Republicans are the reasons that things are bad in San Diego County. Well, what about all the other counties where things are bad? Democrats have dominated state government for 25 years. It seems to me, as a libertarian who doesn't like either party, that what we need is a Democratic Gorbachev, someone who breaks with the status quo. It's a bad place to be a poor person in California on housing, on education, on police reform, and yet Democrats align with unions on these issues. So what do you say to the idea that the problem within California politics is fundamentally one of a Democratic Party that is lined up with status quo interests that do not care particularly about poor people?
Well, Chris, I disagree with the premise of your question. I am a Democrat, and I am aligned with interests that care greatly about poor people and care greatly about issues of income inequality, care greatly about issues of racial justice, care greatly about issues of breaking what has been the status quo, certainly as it relates to the County of San Diego and what we're doing. And so I think the agenda that we've laid out and the agenda we will lay out will continue to drive those issues. And when I came in, Chris, I think there was some skepticism. Would I be willing to confront issues of racial justice? I think I showed I'm willing to. Would I be willing to take on the sheriff on issues of what's happening in the jail? I think I've demonstrated I'm willing to do that. And we're fighting every day for issues of equity and wages and fairness. And so, I can speak to what we're going to do at the Board of Supervisors, and I think we're going to move in a progressive direction. And I think we're going to tackle some of these difficult issues that no one ever wants to tackle. I mean, no one steps up and says, hey, I want to own the behavioral health system, because it's a mess. It's really hard. And we have a board coming in, we have energy coming in, and I think that there's a tremendous opportunity to do a lot of good for San Diego. And that's what I'm going to focus on, and that's what we're going to do every single day that I'm here.
Let me follow up on that specific issue. Obviously, COVID is the biggest story right now, setting aside your interest in behavioral health and focus on that. What's very interesting to me this week is that your proposal, you just went to great lengths to describe how it's meant to be fair to all and specifically to help the people who need it most, poor people, communities of color. That is the almost exact opposite approach that Gavin Newsom is taking, which on schools particularly, which is to give $450 flat to every district that can reopen. And the benchmark that he set at the rate that he has proposed keeps a lot of those districts and communities out. They can't reopen. They can't get the money. It's almost like double jeopardy. It seems like it's a complete opposite approach. So I guess wondering, what do you think? You have kids, right? They're at home trying to distance learn. It's difficult, I assume, as your family, as it is for mine, as it is for others. Why are there two philosophical and political approaches there? And what can you do? Are you lobbying to change Newsom's mind in any way on that?
Well, I think one, I mean, I'd let him speak for his education plan, and he can justify why he did it. I think that there is a widespread frustration in general with the issue you just raised, which is schools that are already open are in areas that are less impacted or areas that have less concern with what's going on. And the reality is when you have communities where the prevalence is so high, I mean, you simply, there's just no way that they're going to be able to get going. And so look, the schools issue has been a really challenging one, and it's been a vexing one because we need to get our kids back in school, but you also can't go into a community where COVID's ravaging them and expect that to be a reality and expect the teachers to show back up. And so I think let's see what happens with that proposal as it goes through the legislative process. I think you have, legislators who will shape that and mold that and try and get to something there that certainly seems a little more equitable in terms of what we're facing. But, Matt, the whole COVID is real. I mean, COVID didn't create the inequities in our society, but it has shined a light on them in ways that you can't look away. I would give you one anecdote to demonstrate how severe this is. And again, how the policies, this goes to your question, how do you create policies that tackle this? Early in the pandemic, I knew we had a problem, particularly in South Bay and Southeast, with people who don't historically have access to healthcare. And so we disproportionately put our testing sites down there, disproportionate numbers down there, which was the right thing to do. It's the difference between equity and equality, and it's an important thing. But then I kept getting kind of frustrated because we weren't getting the numbers turning out like I thought we did. And so I had to go into the community and say, look, tell me what's going on, right? We put these sites, they're not being used, what's going on? And you got to listen. You really have to listen. And then I came to the realization, well, a lot of families in those communities, based on their immigration status, they may not qualify for traditional unemployment, even though they work. We know they work. This is the big scam of like, we're happy to have you work and do the work no one else will do. And we're happy to have you pay taxes. But just, when it comes to accessing anything, we don't want to do that because of your status. And so I had to come in and say, okay, well, how would we get around that? Well, we put in place an income assistance fund. Because if you cannot, I'm a parent. Between my wife and I, we have 5 kids. You cannot ask a parent to choose between feeding your children and protecting your health, because you'll choose to feed your children every time. And so the reason folks weren't getting tested was they didn't want to know if they were positive, because then they couldn't go to work and they couldn't feed their kids. And so we created an income assistance fund that said, look, if you test positive, we are going to give you cash assistance to bridge you through that 2-week quarantine, or if you're a close contact. And we're not going to ask a whole bunch of questions. We want you to have confidence to get tested. And then we targeted the outreach of that into those communities with our community partners. Then I realized there was a reluctance of folks to go get tested because they, in the era of Trump and deportation, folks don't want to show up to a government facility and turn over their information. So I went to the Mexican consulate and I said, look, can we do partnership on testing? Because people are comfortable coming there. And then I called the bishop and I said, look, can we partner with the Catholic Church? It's a sanctuary. It is a safe place. And we created a testing program with the Catholic Church, with the consulate, where they got information about the income assistance, about the rental assistance, all those things. And we saw jumps in our numbers and we were able to provide help and assistance. And Matt, I think that's the approach that you have to take if you're serious about addressing issues of equity. So if you're serious about that and you want to help schools in areas that have been impacted, you got to go talk to those schools and say, what is it we can do that would help you bridge the gap between where you are and getting your kids back online? The other thing that we did, Matt, and this didn't get a lot of attention, but I think this was a significant step, was at the outset of this, when we knew it would be virtual learning, the schools did an incredible job of getting every kid a Chromebook. And I give them credit for that. I mean, that's been a thing for decades, right? Okay, every kid got a Chromebook. But if you're a low-income family, that might as well be a brick. I mean, if you don't have internet connectivity. So I called Paul Gothold and I said, what can we do? And we put millions of dollars of county funds into a program, and he went and negotiated partnerships with internet providers and got low-cost access, where we were able to cover the high-speed Wi-Fi connection for those families so that every family in San Diego County would have a Chromebook because their kid got it, and they would have a way to get access online. Now, That doesn't get around the issue of how, if the parent has to go to work and you got 2 or 3 kids at home, how are they going to actually get online and do it? But it was doing everything we could to be very intentional with our policies. And so what I hope will come out of the state will be a similar approach of, you go into the community and you understand the problem and you listen. You actually have to listen. And then you say, what are some ideas or suggestions that might make this work better? And then you actually have to listen. And then you have to go back and build a coalition and fight to get those done. And that would be how I would hope the approach around education in schools would shape out. But again, he's got to go through the legislative process, and we'll see where it ends up.
There are a few politicians in San Diego that have probably as much knowledge of the COVID situation in the county and the attempts to make things better for everyone than you. So specifically then, with that background, the governor's proposal sets the reopening threshold at 28 cases per 100,000 by Feb 1. Do you think do you know if that's the right number, a good number, too high, too low? Is there a magic number? Probably not, but where would you suggest setting it?
It's a hard thing to set it at an arbitrary number. And the reason I say that, Matt, is because what you run into is we go through these waves. And I don't know that the question is necessarily what is the number that you open schools. I think the question is, how do we get countywide to a stability where we're not seeing these wild oscillations in the number of cases. I also don't think February 1 is realistic at all. And I say that because when you look at where we are today, so we were running, if you think back, 200 to 300 cases a day when we were doing well, and then it started creeping up. And a lot of us, remember when our case counts were oscillating, are we at 6, 9, or 7? And I'm like, look, now is the time. Look, we got to slow it down, because once this thing starts, it's a wildfire. And once you'd rather deal with the brush fire than a wildfire. And we lost that battle, and it just exploded. We're now running 3,000 to 4,000 cases per day. We went from 200 to 300 to 3,000 to 4,000, not every day. Some days are lower, right? There's fluctuations. Those are some of the high marks, but it's significantly higher. The other thing that you have, Matt, is we had rising cases, and then we had Thanksgiving, and folks really, I don't think, very diligently followed the orders around Thanksgiving, and that exploded our cases as we headed into Christmas. If folks did anything close at Christmas to what they did at Thanksgiving, it's going to be a really bad next month. And then around New Year's, it's going to be a really bad next month. And then the other thing that I'll put in there is we have the new UK variant. And when we announced that last week, when we had the first one, I was very clear to say, we know of one case today, but there are more, because this person didn't travel to Great Britain. Now we know that there are dozens of them. So now we have a more infectious strain, and we're only able to assess a very small percentage of all positive cases to assess for the UK variant. So whatever the number we know, it is orders of magnitude greater. So what I'm saying is we have a prevalence of cases. We have a new, more infectious strain. And I think our darkest period is going to be over the course of the next 6 weeks. And so I just think a more realistic assumption of getting schools open ought to be focused around, something in the March, April timeframe. But I think that a lot of the resources, Matt, need to go to how are we going to catch kids up? And if we want to address issues of equity, it is going to be a rigorous assessment of where are kids in the learning cycle and how do we catch them up in a way that is individualized and focused. And so I just don't see mass school openings happening in the next 60 days. And I think it's a little bit unrealistic to propose that we're going to do that. I think the plan ought to be, as we do vaccine rollouts, as we prioritize teachers getting them, we know kids are a little bit lower risk. How do we work teachers into the vaccine rollout? How do we help equip schools to get open, particularly those that are not open? And then importantly, how do we dedicate significant resources to catching our kids up? Because very few kids are going to learn. Any parent who's doing this with their kids at home, you're holding on, you're doing the best you can, and it's really hard, and it's just not the same. And so that would be a framework for an approach that I think would be more effective.
Thank you for that thorough answer. It makes a lot of sense. 2 other quick questions on COVID before we turn to other subjects from me. One is, and I think I saw this in Gary's story today, that you are more open to enforcing restaurant closures, mask wearing. We've been calling on that for a long, long time. A lot of sheriffs have flatly said elsewhere in the state, no effing way. And it's become very, very politicized. What can you do? What will you do? And when would you do it?
So let me take those in order. First off, what a number of sheriffs have done is wrong. The Riverside County Sheriff does not determine what laws he chooses to enforce and what laws he doesn't choose to enforce. And I think that the sheriffs that have come out and told people defy the law, a public health order has the effect of law. And in law enforcement, you don't get to choose to enforce the ones you like and don't enforce the ones you don't like. If a sheriff of a county wants to make that decision, they can run for governor, or they can go get a medical degree and be the public health officer. I just think that's very bad. You don't get to choose. I remember at length Jerry Brown talking about when the death penalty was a thing. He said, "Oh, I'm opposed to it, but it's law. You know, I have to follow the law." And I think that that has significantly undercut our ability, because when there is no enforcement of an order, it sends a devastating message that it doesn't matter. The other thing is it's a green light for people to defy it, because if it's the cops telling you, the law enforcement telling you, well, okay, then they don't think it's bad. They're the ones in charge of it. And that has been devastating. Now, our sheriff has been better, but he was very reluctant and early to enforce these measures and to do it. And the previous mayor, I think, had provided some direction to the chief. They were reluctant to do it as well. And I don't ascribe that to the chief. I think that was Mayor Faulkner who said, no, we're not going to be aggressive enforcing. And Matt, I can't tell you how many times I spent begging folks, because from a public health agency, that's what we are at the county. What we can do is issue a cease and desist letter or a public health closure notice. That is the extent of our legal authority for what we can do. And we are doing that. We are issuing hundreds of those. We're disclosing them on our website. Now, I brought forward an effort to have enforcement teams go. We got some, but out of the 3 options, the board only went with option 3. And so we will be bringing something back to go back to option A to have more enforcement teams. But we need that law enforcement engagement, because when we go out, and again, no one wants to be punitive and no one wants to destroy anyone's. I mean, no one runs for office to say, I'm going to run for office to close restaurants. I mean, it's nuts, but we can't escape the hard choices we have to make. And so I think we're getting in a better place. I think what Mayor Gloria has done with the city of San Diego and changing their posture and changing their attitude is a very positive step. And we tend to focus on the handful of folks that are in blatant defiance and they say it's not fair. Well, how about it's not fair to all the folks that are following the rules? It's not fair to them that they are at a disadvantage to folks who choose not to. And how about it's not fair to the 1,700 San Diegans who died, who might have been exposed because people were choosing not to follow the rules. And so I think what City of San Diego is doing is really good. Encinitas is doing is really good. What Carlsbad is considering is really good. I was frustrated with alcohol beverage control not stepping up to enforce. They have the greatest tool around liquor licenses for people that are in defiance. I called the governor, I expressed my concern. He called someone at ABC. They are now much more engaged and they are much more helpful in what we're doing. And I want to share with you, I just got this and I'll get the raw number of out of the places we visited who we've had a complaint on, 90% of them have come in compliance after we made a visit. So we go out to the gym, the bar, the place, 90% have come in compliance. Out of the 10% that didn't come into compliance, we issue a cease and desist or public closure notice. Out of those folks, more than half of them come into compliance after we issue a cease and desist or a public health closure notice. The ones that are left are the ones that get referred to law enforcement to issue a citation and to the city attorney or DA to prosecute. And those do get a lot of attention. But it is a relatively small number of total. And so I think our enforcement has gotten better. The sheriff came along, I'll give him credit. He said, okay, fine, I get it. I'm going to dedicate deputies. We're going to go in any jurisdictions and issue it. That was a significant step, and he's doing significantly more than other sheriffs are, particularly when you have situations like in El Cajon, where the mayor of El Cajon says, I'm going to direct the police. We will never enforce anything. Well, then we have sheriff's deputies who can go into that jurisdiction and enforce. And again, nobody wants to be punitive, and none of us take any joy in doing this. But when you look at what's happening with our healthcare system capacity, enforcement has to and must be a part of what we're doing. And so I think
Supervisor, I have to say it's a complete crock to say that discretionary enforcement is unusual. It's a complete crock. From immigration to jaywalking, police all the time make these decisions. So while I agree with you that of course they should enforce these rules, the idea that there's anything unusual about police picking and choosing which laws to enforce is a crock.
Okay, Chris, you tell me where you've seen a law enforcement official come out and say, That is a bad law. I disagree with it. I will not enforce it and encourage people not to enforce it. You show me an example.
2011, the Obama administration. 2011, the Obama administration put out what was called the Morton's Memo that told folks they don't have to enforce immigration laws.
All right, he wasn't law enforcement, but you're close. You're close. Look, look, Chris. I think it's devastating. I think it's been bad. And
I completely agree with you, but the idea that it's unusual is a crock.
Oh, that it's unusual?
It's not unusual. Police always choose what resources to use. Police make these decisions all the time. It may be horrible, but it is not unusual.
It is, I will say it is not common for them to come out and publicly state, we are going to choose to not enforce any of these at all. They may use discretion. It is very rare that they come out. And again, this hasn't happened in San Diego County. This is more other counties where sheriffs have come out and made a political calculation determination to say, I disagree with this and we will not enforce it. I think that's very rare. You can find isolated examples, but I think it's rare. I also think it's devastating, Chris, because again, look, you've got a public out there that is trying to figure out what's going on, and they're not epidemiologists, they're not medical doctors, they're not reading the peer-reviewed studies, they're not assessing the viral loads and intensity of duration and exposure and case counts and all of that. And they see a public health officer say, you got to do these things because it keeps you safe. And then they see a story about a sheriff who says, no, it's nonsense. There's no evidence for it. Don't do it. And then they see a supervisor go out and say, look, here's the reason why we got to do it. And then they see another supervisor go out and spew nonsense. And then they see a judge come out and say, yeah, strip clubs are great. Let's open strip clubs during a pandemic. And that mixed messaging, I mean, look, there are ideological differences between folks, and we can have heartfelt ideological differences on those things. If there was ever a moment in our country, one time where we just needed to work the damn problem, it was here. A pandemic is not ideological. And wearing a face mask is not a statement of your liberty. I mean, it really isn't. This is if we ever had a moment where we could have come together and said, whether you want to keep businesses open or save lives, you do the exact same thing. And I remember early in the pandemic, we had a press conference here at the county when we were all still standing next to each other indoors, and it was all the folks from all walks of the spectrum. And I came back to my office and I told my staff, I said, that was wonderful and incredible. And I fear that it won't last because we're so divided right now. This will become partisan. And unfortunately, what Trump did and where he went, and this became ideological. And some of that has carried over into some of the enforcement pieces and some law enforcement. Again, not particularly taking aim at our sheriff, who was less inclined to do it, but was much better than the other counties and has come around. And I give him great credit for the approach that they're taking now. But Chris, I do think it is reasonably unprecedented. You can point to a memo from Obama, reasonably unprecedented for law enforcement to come out and make a public pronouncement to say we will not enforce these things because we don't believe they're valid.
I think we should move on from.
Can I ask?
Although I would say that short-term vacation rentals is probably a more apt example of a law that law enforcement has chosen to.
Quick follow-up on, and hopefully you can stick around a little longer if you have a few more minutes, because we haven't even got to other issues. I still have a couple questions on COVID. Follow-up on this. So are you saying that there will be fines for, you didn't talk about mask wearing. Will there be fines for mask wearing?
We don't have any mechanism that I'm aware of through the county where we can do that. Again, I think that has to be done by a law enforcement agency. Okay.
And the sheriffs or no?
You guys control sheriff, but I can't tell the sheriff what to do.
You control the sheriff's budget. You have a little bit of negotiating.
Well, there's some case law on that limits what you can do there, but yeah.
10-4. Okay. And then on the politics of COVID and on the names of your colleagues you just mentioned, you mentioned everyone except for Jim Desmond, who you have publicly sparred with, who frankly has come across as anti-science in some ways and been a stumbling block in some ways to the county's efforts. My question for you is, I guess, twofold. One is, how do you expect to work with him going forward? And was it retaliatory of you to give him 7 appointments, which is half what the next closest person got?
Well, I mean, look, I'll take it in a couple ways. Look, I don't know what good to say about Jim Desmond right now. And I'd love, you're supposed to do this thing where everything's good and we all love each other, but sometimes we just need to be honest. And I'm indescribably disappointed in his approach. And it's not because we disagree. I disagree with a lot of people. But he has fundamentally taken an approach that makes no sense. I mean, how embarrassing is it when we have to take a county public health doctor to go on the record with your reporters to fact check nonsense a supervisor is saying that he's been told is not true. I mean, what do you do in that situation? And he has fundamentally undercut the public health orders. We had a place, we send an enforcement team out to a restaurant in Carlsbad. They go and they say, hey, you're not following the rules if you could be open. You're not wearing masks, you're not doing any of this. And by the way, you can't be open right now. We issue a cease and desist closure notice. And then the next day he goes with media and social media and says, oh, it's great, it's safe, they're following all the rules, come out here. He is fundamentally undercutting everything that we're trying to do. And I don't know, at times it seems like he doesn't understand when he's talking about pure deaths. I don't think he understands underlying health conditions. So Matt, I'm incredibly frustrated. And I don't know what you do with that situation. When someone is told what you're saying is not true, we can disagree about levels of risk. We can disagree about general approach. But when you're repeatedly telling someone that is factually not true and they continue to perpetuate it, they are systematically undercutting our ability to respond to the pandemic. And it causes tremendous dissent because we go out and say one thing, he goes out and says another, they get equally covered and the public gets confused. And so, I don't know. I don't know what to make of what the next 2 years will look like with him. When it comes to committee assignments, I think Supervisor Desmond ought to Google equity and equality to understand the difference, because he kept saying yesterday, well, this is not an equitable distribution of committees. Well, I don't think he understands what equity is. We could draw him the little picture with the kids and the stools and the fence, but for 40 years, folks like him have filled every one of these committee assignments. And now we have the first Latina in history, which means there's never been a Latina on any of these committees, which means those communities have never been represented on any of these committees. And so Nora Vargas will have to work harder and do more. But if we're talking about equity, we're talking about raising the bar to a point where folks have equal representation, which means some people are going to have disproportionate access to those types of spots. So what we did was very equitable. It was not very equal. But when you have an inequity and you do equal, then you continue to go like this. And so I think maybe an understanding of those two. And then I don't know if it was punitive, but how many places when you have someone who are going to repeatedly go out and say something that is not true, and then you're in a position to decide who you're going to put out in positions, well, yeah, you're going to choose not to put that person in as many positions if they're going to go out and do irresponsible, reckless things.
Quick follow-up on that, because obviously much is made of the first Democratic-controlled county board in a long, long time. But you need 4 votes on many of your budget issues and other issues. So you'll have to work with either Anderson or Desmond. Are you just assuming then that your efforts will be with Anderson? Or do you think that, like, how do you get that 4th vote on the issue?
Well, I mean, look, the first thing is that Desmond's so erratic, you may just get his vote just because he's confused on what you're doing. But the other thing is, I think, look, Joel, I work well with Joel. And Matt, look, I came into here as the only Democrat on an all-Republican board, and I had more than 70 policies passed. We can find a way to sculpt a coalition, and I'll still work with Jim Desmond. I want to work with Jim Desmond. I just would like Jim Desmond to live on the same planet as the rest of us, and it would make it easier to work with him. And so if he wants to work collaboratively, I'm here. My door's always open, and I'm willing to work with him. But it appears to be much easier to work with Supervisor Anderson and Supervisor Lawson-Remer and Supervisor Vargas, because it's just the nature of the ability to interact on a factual basis. So I'm here, I'm ready, I'm willing to work with them. If you're gonna do a fiscal issue outside of the budget, you do need 4 votes. If you do it in the budget, it's only 3 votes. And so that does complicate. But look, I think Joel Anderson has a great opportunity to come in, to work. There's a lot of areas, things we care about, we share interest in. I think he is committed to service. And again, if you go back to his legislative record, he co-authored, joint authored, partnered a lot of times with a lot of Democrats on things you would not expect. And I think that he will hold true to his convictions and values, but be willing to work. And Matt, at the end of the day, what I want in a supervisor is someone who knows what they're doing and why they're doing it. Look, Diane Jacob and I disagreed often, but I had the utmost respect for Diane Jacob because she knew what she was talking about. And I might have disagreed with her position, but it had a rational basis that she could articulate, and I could understand and say, well, I disagree, but I understand where you're coming from. And when you have that situation, then it's easier to pick up on the next issue and work together. And that's what all I think we need in the Board of Supervisors, is we do that. And then if we're going to be reckless on things, not being reckless on a global pandemic that's killing people, go be reckless on something that doesn't have such severe consequences. And so that's a challenge we face.
One last question from me before I kick it over and open to others. Talk about working relationship with someone that you disagree with. Let's talk about the sheriff, who you kind of mentioned case law. And, I think our board's position is that you could be a little more forceful as a board with him over budgeting, but I understand if there are limitations on that. But specifically on healthcare and on jail deaths, where the sheriff's view does not comport with yours, does not comport with ours. He doesn't even agree with the reporting that the Union-Tribune has righteously done in many cases on these jail deaths. What's going to change? It seems like you guys have the votes for healthcare, so that is a done conversation. So let's dispense with that if that is in fact the case. But how about jail deaths, or what you can do to make the sheriff do his job better?
Yeah. Look, I mean, I've told the sheriff, I don't want to fight with you. I'd rather work collaboratively with you. I'd rather do this, but I'm not going to just roll over on things that I think are in our interest as a county. And so if I have to fight with you, I'll fight with you. I'd rather not. And we've had instances where we had to, over the Truth Act, over some use of force policies, over National Guard being called out, over the deaths in the jail, the medical type system. And, there's a great tension, Matt, that is taken in multiple counties. It's not just here, LA, Sacramento, other places, between boards of supervisors and sheriffs. And sheriffs are written into the Constitution, and they have absolute constitutional authority to set their own policies and procedures. You do have some budgetary pressure, but there are some provisions in the Constitution around not limiting their investigatory powers that tie you up just a little bit. But we do have leverage, and we do have a point at which we can exert some influence on what happens. And I think a new board will be more willing to do that. I think in the previous board, I could make symbolic statements about what I thought should happen, but that was an area where we had virtually no success. I couldn't get a second on the motion to say, let's go a different direction on jail health. So, I think, again, sheriff wants to work together. I'm willing to work together with the sheriff. I'm not willing to roll over. I'm willing to work collaboratively and make reasonable compromise. I'm not willing to roll over to something that I don't think is in the best interest of San Diego County. And an area where, we ought to be able to find agreement is around jail health. And we're still not there. It's better. The sheriff's not going to outsource the nurses. That's a positive step. But that is not singularly what I had proposed. What I had proposed was actually creating a Department of Correctional Health where all of the levels of healthcare service would be integrated with the safety net care folks get when they get out. And look, there are places where the private sector can do things better. Jail health is not one of them. It's not. The way you make money on jail health is you deny care and you deny services when you understand the nature of the capitated rate. And the way you make money in a lot of other parts of healthcare is you do procedures you shouldn't do. The way you make money in jail is you don't do procedures you should do. And WellPath has a devastating track record. I mean, they brief their investors that lowering recidivism is a threat to their business model. Correctional health ought not be for profit because the incentives get the wrong outcomes. And so the sheriff still has a lot of aspects of the jail that have already been outsourced and they're disjointed in a lot of contracts. I want to see how we bring those into an integrated system of care along with the jail nurses. And I know, Matt, I'm accepting that as a county, that means we're going to have to make an increased investment. But the thing is, it's an increased investment that is the right thing to do to help people rehabilitate and get restoration. But it also saves us money because if you get discharged from the jail and we haven't got you on a good substance abuse program, we haven't got you on a good mental health program, we haven't dealt with your underlying health conditions, you get discharged, where do you go? Will you show up at our psych hospital at a high level of acuity? And then we cycle you back through this process of incarceration, poverty, back and forth. If we want to break that cycle, when we get people and they're in custody, we've got to get them well. We've got to get them on treatment programs. And then we've got to have a warm handoff into the system outside of there with our continuum of care, with our care coordinators, with our integrated behavioral health system that we're building out in its entirety there. And so I'm going to continue to push for that and continue to do everything I can within the powers we have to get us there. And we are making progress. We are making progress, but it's a challenging and difficult situation.
Thank you for that. Others with questions?
Supervisor Fletcher, I was hoping that you could jump back to the vaccine just for a minute. I'm sorry, the pandemic just for a minute to talk just really quickly about the vaccine rollout.
Yep.
We're hearing rumblings about paramedics, pharmacists, dentists, maybe the National Guard stepping in to help out a little bit. And you have been transparent, both you and Dr. Wilma Wooten, about having these press conferences and keeping people informed. But can you just touch a little bit more about the rollout? When are people going to see it, especially people in communities of color that do not have health insurance?
Yeah, Laura, I am very concerned with the structure of the vaccine distribution, and I am working as best I can with state trying to do it. Here's the fundamental problem. The fundamental problem is we have a disjointed nature of healthcare in America. It's fragmented, it's disjointed, and that creates these inequities. And then a pandemic obviously exacerbates those. Well, with vaccine distribution, someone in DC decided we're going to send CVS all the vaccines to long care facilities. Well, I don't know how they're going to go out and do long-term care facilities. Pharmacists do vaccines in the pharmacy, but now they're getting them direct from the feds. We don't even know how many they got. Then you have all of your healthcare systems that are getting vaccines directly sent to them, and they're doing a process for how they're going to do it, and they're supposed to follow the same protocols, right? But it's disjointed. And then the county got a small number of vaccines, and then the DOD got them direct, and the VA got them direct. And so right now at the county, we're really in a role of kind of air traffic controller. Because the way it appears now is when it's your time to get the vaccine, you will go to your healthcare provider if you have one. And then if you don't have one, the county would set up a safety net level of vaccines. That is a disjointed system. I mean, I can't tell you with absolute confidence today how many vaccines have been received in San Diego County, because they went to so many different places from so many different people. And that is not what we need to do. I think the system would work better if it was centralized. I think if the vaccines were sent to the county, then we could set up hubs like we've done with testing. We have more than 40 different locations around the county. We are doing more testing per person than almost any county in California. You go to the website, you can make an appointment. We have a site near you. You can get it. You can get your result within a day and a half. We could replicate something like that for vaccines. But again, we don't have the allotment of them because they're dispersed so widely. And that's where you see these individual stories about someone got it who maybe shouldn't have. Okay, well, now we got to track back which system was that, and then, why did they make that decision? And so it's hard to adhere to it. And so my hope is that in the coming weeks, this vaccine distribution process will be tightened up, because I don't think we're set up for success in that regard. As it relates to paramedics getting it, that was a county program, and we did that very intentionally, and I'll share with you why. When you have to do mass vaccinations, I did legislation in the assembly in the aftermath of H1N1 about pandemic outbreaks and who can give shots in a pandemic outbreak. And so I've worked on these issues for many years. When you have to do mass vaccinations, you have doctors and nurses, people that normally do vaccinations. Well, they're really busy right now. I mean, they're really busy. So we realized paramedics can do vaccinations. And so we brought in with the city of San Diego and the fire chief and Mayor Gloria and said, look, let's get all your paramedics in. Let's train them to be vaccinators. Let's have them work some overtime if needed. And so they've been getting the vaccine as a part of a program to train them to be vaccinators. So then we can deploy them out to places. So we're increasing a healthcare workforce that is not overtaxed. And so that was the nature of that. But I hope that there's some opportunity to streamline the vaccination process, because right now I can tell you the tiers and I can walk you through who ought to be getting it. But again, it's very fragmented and disjointed. So at the county role, we're really kind of an air traffic controller, trying to keep everyone. We send a letter, please, if you have excess, let us know. We'll direct it to where it's most needed. If you have some that are going to expire, don't just randomly start picking people, let us know, because we want to hold fidelity to those tiers. We don't want people jumping the line. I will joyfully get the vaccine when it is my turn. I will not get it before a healthcare worker gets it, because that's not right. But it is a challenge. We're working tirelessly. We're trying to be very transparent with, this is the situation. This is what we're doing. I hope by next week, we'll be able to have better data on how many have been received and how many have been put in arms. One of the challenges on that, SDIR, San Diego Immunization Registry, is where we do it. If you're a pharmacist, you have 14 days to enter that into the system. Well, that's a significant lag. And so we're working through all of this, but it's a lot of people involved, and I don't think the structure is ideal. But whether this structure remains or it changes, we're going to do everything we can. We'll share with you everything we have, and we'll fight all day, every day to try and make the system work with an eye towards equity, Laura, to make sure that those communities most impacted when you get into those tiers, those ought to be the first ones to get it. So if we're doing clinic workers, it ought to be San Ysidro and Family Health Centers. They have the highest percentage of positives. They ought to get it first. And then there should be no bearing on if you are insured, uninsured, documented, undocumented. No matter your life, you're eligible for the vaccine. You will get the vaccine from the county.
Thank you.
Thank you.
The LA County Board of Supervisors is considering a $5 pay raise for retail workers and grocery store workers. Is that something you've considered?
Oh, they're doing like a minimum wage pay raise?
Yeah, just for specific workers, like frontline workers that weren't really expecting the job, specifically grocery and retail. It just came out yesterday, I think.
Yeah, I'd have to look at it. I haven't really thought about that. I did support the governor not waiving the minimum wage increase for this year. I know it's a tough time on business, but it's a tough time on frontline workers as well. And so I was supportive of that. I'd have to take a look at what LA County did. But we also would only apply in the unincorporated areas if we did it.
Seeing other questions, I went on tracing. We talked a lot about vaccinations, but
yeah,
still tracing and getting to the roots of these problems and potential outbreaks is an issue. What should the county be doing differently on tracing? And how do you assess what's been done to date?
Yeah, this has been one of the big challenges, Matt, and this has also been one of the big disconnects in that the data that supports the public health steps we're taking is the data around transmission of the virus. It is the peer-reviewed studies about how a virus transmits and the mixing of individuals. The reality is the data from contact tracing and the data surrounding outbreaks is very limited. Because if you test positive today and we ask you where's everywhere you went in the past 10 days, how would we know you went 25 different places? How would we know which one of those 25 is where you got it? It's very hard. It's very hard to assess where you got it. Now, contact tracing allows you to group those folks together and make some assumptions. But the data associated with outbreaks, if you take all the cases tied to outbreaks, it is way less than 10% of the total number of cases because it's very hard to ascribe exactly where someone got it. And I think one thing that we could have done better is getting that app up and running sooner. I was very involved with UC San Diego and the researchers there, Christopher and others, in trying to get that approval process through. That took longer than I want. A lot of folks are adopting. I think that's a technology, if you choose to opt in, that is useful. And then, we've got 600 plus people now we brought on that are doing case investigations and contact tracing. I think the case investigation part of ascribing where did you get it is less useful, again, because it's just hard. It's out there everywhere. I mean, how would you know? I do think the close contact process is important in that if you test positive, we want to know who's everyone you've had a close contact, and then we want to call them. And we want to say, look, you've been a close contact of a positive, you need to quarantine. We have public health rooms available. We have resources available. We have help for you. And the hope is that people take that seriously. I had that happen last summer. I was a close contact of a positive. I had to quarantine for 14 days. I did it. I ended up not getting it. But I think that the close contact piece of that is valuable. I think the case investigation part of it has just proven to be less valuable because of the nature of how COVID spreads and the prevalence of it throughout the community.
Supervisor, I know we've gone long and you've got to go, but I do have to get back just to the finances for a second. Everything you're talking about is costing money.
Yep.
And you did mention the reserves at one point and how long they were. They were 2.5 to 3 months. Your burn rate right now must be just incredibly high. And I'm just wondering, where are the reserves now? And what does this mean for the future if you appear to be saying that we shouldn't be so focused on having that level of reserves in the future?
Well, I think we've got to right size. I think we have to right size the approach. I think we've missed a lot of opportunities for investment. I think we've missed a lot of opportunities to draw down state funding and federal funding. And we'll have a clearer picture when we get to March of kind of where things are. The Federal CARES Act funding were incredibly helpful to us. It helped fund a lot of what we were able to do from a public health thing. But we no doubt have tipped into reserves, both in the increases around investment in behavioral health, along with some other types of things we've done. Some of our economic assistance to businesses came out of that, some of the other types of things we did. I still think that we are in an incredibly strong financial situation. But, Andrew, reserves are not built up to look out on a wall. They're built up to use in a period of difficulty. Well, this strikes me as a period of difficulty. This is what you have reserves for. You draw them down in times of difficulty and you build them up in good times. And so I think that what we have to assess is, from one standpoint, what is an operating assumption of what we need in good times on an ongoing basis? and then what is appropriate to draw from now because we are in a crisis and a bad thing. And those are two very different conversations. You know, one is a mindset about what do we need to retain at all times, and the other is a mindset of okay, we're in a state of crisis. What can we draw out of, and how long can that guide us through and last us through? And those are the things that our fiscal policy or committee are going to work on and assess around that, and how we adopt truly best practices.
Presumably, as the chairman of the Board of Supervisors, you're going to have a lot of input on SANDAG. SANDAG is looking at the 5 big moves built on the notion that people will actually embrace transit. Where is the history in the state of California of people embracing transit on the level that SANDAG's board chief talks about? And when are we going to ever get the folks admit that, you know, you say, there's always this rip on Republicans for ignoring science and history and evidence. California has not embraced mass transit, and yet now we're talking about spending $187 billion on a plan that based on the idea that the public will embrace mass transit, even as it gets older. I mean, come on, where is the realism and honesty here in our transit policies?
So, all right, so a couple of things, Chris. One, I'm not on SANDAG. 2 other supervisors are on SANDAG. I am chair of MTS, and I'm happy to speak to this from an MTS perspective. It's kind of funny, like when we don't invest in building out something that works, and then we say it doesn't work. Yeah, well, no kidding, because we haven't invested in building out. And I will tell you this, pre-COVID, Chris, go pull the numbers. Our MTS ridership was increasing every single month. We were seeing month-over-month gains because we did a re-engineering of our routes and we made changes on the Blue Line. And transit's never going to be an option that everyone takes, but you don't need everyone to take it. You need to increase the opportunities for people who it's their only option, Chris. Look, we have invested trillions of dollars in roads. The investment that we make, we subsidize every form of transportation out there. You buy your plane ticket, it didn't build the airport. You buy your cruise ticket, it didn't build the port. You know, you get on the road, your gas tax doesn't pay to build the road, and you pay to maintain the road. We build there's no sidewalk tax, but then when it comes to transit, we're like, oh, well, it's not full cost recovery, it doesn't make sense. No, people will use transit. And there are multiple examples around the country where you can see an increased utilization of transit with an appropriate level of investment. And I think that what we had on the table at MTS was great. We had projections where we could get you equivalent to the length of time it would take a car along some of our highest density areas and highest congested areas. We have opportunities to put our housing in conjunction with transportation lines. And Chris, there is a generation that is not my age or your age, but there is a generation out there that views the world a little differently than you do. And I saw it in my students at UCSD. When I was 18, I couldn't wait 16 to get my driver's. They were like, I don't want a driver's. I don't want a car. I want a different kind of life. And I think that there is an opportunity to invest, not in the world that you want, but in the world that other folks in San Diego County want, where they have some transportation options. So we'll see what SANDAG comes out. My focus on the SANDAG issue is making sure that there is funding for MTS, because I can invest now in rapid buses. I can take shoulders of freeways. I can run a bus going north on the 805 South in the morning and vice versa in the evening with the movable lanes. There are things I can do with grade separations to increase the ability. We have more need on the Blue Line post-COVID and other things. And so if MTS can get some more funding, I can show you, I can get riders commensurate with that funding. And that is my highest priority in what comes out of SANDAG.
So do you honestly believe that?
Nathan actually has
18%?
to leave. Nathan has to leave. So and I have one quick question for you on another subject before you do. I think you can just answer it in one word. But you mentioned climate change. Obviously, if we were talking about COVID, it would be the most pressing issue facing society.
I agree with that.
And as we all know, the county famously has messed up its climate action plan and been tilting at windmills to try to get the thing right, got it wrong repeatedly, lost in court. When will the county get it right? You obviously have the votes now, so it's not a question of whether you can, but when you will.
Now we will. It's going to take a little bit of time. That's the board letter I'm doing with Tara Lawson-Reamer. We believe it's real, legally enforceable, and we are working on that plan right now. We know what we have to do. And we got 20 opinions from Judge Taylor telling us exactly what the law is. We know, now we just have to do it.
Okay. And I know you got to run. I think we could.
I'll come back and talk transit with you. I will.
I was going to say, come back. There's plenty of issues we can argue about and talk about. So this has been a great fast hour. Thank you, Nathan, and good luck to you.
Thank you all. Thank you.
Thank you.